Thank you. Good afternoon, everyone, and a very warm welcome to the East and Southern, West and Central Africa cross-regional learning platform on ending child marriage. My name is Mona Aika, and I'm a child protection specialist for UNICEF East and Southern Africa Regional Office. I'll be co-facilitating this webinar with my counterpart, Catherine Muller. I think, Catherine, you can have your video on and wave. She's the child protection specialist in West and Central Africa. In today's webinar, I'm sure for those who logged in earlier, we have simultaneous interpretation in French and in English. And we are encouraging all participants to click on the interpretation icon, which is at the bottom of your screen. At the bottom of your screen, and select the language of your choice. So for even if you prefer to hear this webinar in English, click the English option under the interpretation icon. And for those who prefer to have this webinar in French, click the French option. A few webinar etiquettes. Just as when you're speaking, when you come on, when you have that opportunity, please try and speak a bit slower so that our interpreters are able to interpret properly and not miss out any of the important information that you're sharing. I'd also like to request all the participants, if you haven't done so already, to introduce yourselves by typing in the chat box your name, country, and organization you work. Also asking all of you, dear participants, to mute and turn your videos off. We only want your video on when you are speaking, when you're given the opportunity to speak. So all the webinar etiquettes are on that slide. You can still see them. And the next part, what I want to do is to give a brief explanation on what this platform is all about. Just as a bit of history for those who are joining us for the first time, UNICEF West and Central Africa, together with the East and Southern Africa regional offices, contracted Child Frontiers, which is an international institutional consultancy firm with expertise in the various areas, but the ones that we've hired for this piece of work are the experts on ending child marriage. And this was done under, the umbrella of the European Union Spotlight Initiative for Africa Regional Program. And of course, the UNFPA UNICEF Global Program to End Child Marriage. The focus of this work is, it covers two areas. The first one is for the consultants to support us in the development of 13 country strategy notes. And these countries are Uganda, Malawi, Mozambique, Zimbabwe, Ethiopia for East and Southern Africa. And for West and Central Africa, we have Benin, Burkina Faso, Ghana, Guinea, Mali, Niger, and Sierra Leone. And what the consultants have done for us so far is to work across various sectors in country, across the 13 countries that I've mentioned earlier, and really drawn out what needs to inform and support our efforts in accelerating our work on ending child marriage. And this is done through a pragmatic, evidence-based, and contextually appropriate adjustments in the course of, the analysis and strategies and approaches that have been seen to be effective on the ground. The second piece of work, which is more relevant to this session we're having today, is for the Child Frontiers to support the establishment of a virtual learning platform for these insights and other information and knowledge to be exchanged between the countries and across sub-Saharan Africa. So this work started back in 2022, I think it was July, and it will run until the end of this year. And already we have several of the ending child marriage strategy notes available, and those will be shared. But today's webinar, as many of you already know, it's on child marriage in the context of climate change. I also want to remind you that we have a mailing list that we use to send out details on future webinars and publication in our through our monthly newsletter. So if you haven't done so already, I encourage all of you to sign up so that you can receive, the most recent updates and webinar reminders. So if you check the chat box, you will see a short form. Thank you, Betha, for placing it there. Click on that short form and quickly provide your details so that you can receive automatic updates. So let me now take you through the webinar outline. We will start off with a brief overview of child marriage and climate change research that was done particularly in this region, and also lessons coming from the global north. This will be done by Gillian for about 10 minutes, and then we will again zoom in, and I'm not sure if the presenter already confirmed, but we had planned to have a session on the impact of climate change in Africa. And following that, we're going to now get the details of a research on child marriage and climate change in Kenya, the region where I'm in, where you'll hear some of the key research findings emerging from a study on child marriage in the context of prolonged climate change related to drought, floods, and many other concerns in Kenya. That will take about 20 minutes of our time. Following that, we'll then hear from colleagues from Mozambique and Ethiopia, who will now give us some insights on what it means for policy and practice. And this will kind of, respond to the previous session on the research of climate change in Kenya, which will be delivered by Ken Ondoro of Child Frontiers. So the countries, Mozambique and Ethiopia, will give us some responses to Ken's presentation from their own perspectives on what they think these kind of impacts mean for the responses to child marriage in their respective countries. Following that, we'll have a discussion or a question and answer session. And of course, this is an opportunity for all of you who have logged in today to raise your hand or type in the chat box a question or comment that you have so that we can have an active and lively discussion. Following that, my colleague Catherine will then come in to do the wrap up and closure of this session. Lastly, I want to remind everybody that if you have any questions in the course of the various presentations, use the chat box so that you don't forget what you want to share with us. And of course, at the end, we'll give you an opportunity to raise your virtual hand to speak at the end and intervene. Also, just to let all of you know that all the slides that are going to be presented today will be shared in a Google Drive folder, and Betha of Child Frontiers will also, paste another link in the chat box for you to access. So, without further ado, I'll now like to pass the virtual floor to Gillian Mann of Child Frontiers to take us through the first session and give us an overview of what climate change is all about in the region and beyond. Over to you, Gillian.
Hi, everyone. Can you hear me?
Yes, hopefully. We can.
Yes, you can. I can't. Great. Good morning from here in Ottawa. Bon après-midi, bonne soirée pour tout le monde là-bas, and good afternoon, good evening to all of you. Thank you for joining us today. I am going to make a short presentation. Emily is going to help me with the slides. And she's going to put the first one up here. Yes. And this is just really an overview of what we know when it comes to climate change and child marriage. Unfortunately, the speaker that we had organized, who was going to make a very particular presentation with respect to climate impacts in Sub-Saharan Africa, particularly at the last minute, was unable to join us. However, we have included some of that information within this presentation. And I see from the chat box and the names of people who have joined that we have many experts on board today as well. So I encourage you to share your insights and knowledge when the opportunity arises. So, Emily, if you want to go to the first slide. I should say, well, first of all, this is quite an obvious point, that what we know about climate change is that as the world heats up, the climate is changing. The result is that we are having more frequent and less predictable extreme weather events. So while we have always had storms and heat waves and droughts and floods and wildfires, we are having more of them. We are having more of them at strange times, and the predictability of these events has been diminished significantly. Next slide. Yeah. So very recently, a review of research, all of the studies that were conducted on climate change and child marriage between 1990 and 2022 was conducted. This review showed quite clearly that heat waves, floods, cyclones, and droughts have all been linked to increases in child marriage. So we know that climate disasters and extreme weather events increase the risk factors for child marriage, not just in the immediate term, i.e. in the chaos in the midst of the weather event, but also in the longer term, especially when it comes to the kind of slower onset impacts that accompany these changes, for example, diminished crop productivity, etc. Next. So the big picture is one that all of you know all too well, I'm sure, and that is that climate change and the climate crisis is considered to be a threat multiplier. And what we mean by that is that for those who are vulnerable, for those who face many risks in terms of inequality and other types of threats and risks, the climate crisis just multiplies those risks. So it increases the vulnerability of those who are already vulnerable. In other words, when we are thinking about girls, we know that they have to navigate the climate change on top of gender, age, and other related risks that they already face in their everyday lives. And we also know that even very small variabilities in things like rainfall can devastate food supplies, particularly in countries that are dependent on subsistence agriculture, as many of those are where we are working. Next. I'm going to whiz through some of these because I'm quite sure that most of the things that I'm going to say here are known to all of you. But, first of all, in terms of the known impacts, I'm going to talk about four very, very briefly. So we know that in the immediate aftermath of these kinds of extreme weather events, that girls are exposed to increased risks of sexual harassment and abuse. Also to other concerns around their safety and well-being with respect to the lack of safe services. This is in the immediacy and in the immediate aftermath of a climate-related event. Emily, next one. Again, this is a known impact when we talk about families being pushed into poverty. We know that in many contexts, child marriage is a mechanism to respond to the loss of income and food shortages. And in very dire circumstances, these increased losses can lead to a kind of a last resort for families and girls themselves. Next. Of course, another known impact is that families and entire communities are compelled to leave their homes. Many girls are forced out of school as a result of this displacement, and we know that girls who are out of school are at greater risk of marriage. So this is a kind of layering of the vulnerabilities, the multiplying effect that we were talking about, because there's sort of an overlapping risks for those who are already vulnerable. The Population Council actually reported today a new figure that I hadn't seen before, which is that 12.5 million girls every year cannot access education for climate-related reasons. So these are significant numbers of young women who are unable to access one of the main protective mechanisms for them to avoid marrying or having babies at a very early age. Next. Again, this is related to the poverty impacts and also to loss of livelihoods, but girls have reduced access to food and water, and also to the services that they need to be safe, to be healthy, and also importantly, when it comes to reproductive health and contraception and other reproductive health services such as abortion, there are increased inability of young women to make these decisions about their lives. So in environments where they hardly had any, very often now they have none in terms of decision making. We know, for example, that in parts of Ethiopia, worst hit by the drought and food shortages in the last few years, rates of child marriage have increased. UNICEF report said that in 2022, rates in these districts were 119% higher than they were in 2021. And we know that research conducted by Save the Children in 2022 in drought-prone communities in Zimbabwe showed that more girls than typical, because they don't have any baseline figures, more girls were initiating their own marriages in an attempt to access food than had previously been the case. So we see all kinds of decisions happening in relation to the kind of desperation that these climate crises are imposing upon people. Next. Next slide. Yeah. So this fact I find very striking, and I'm sure that many of you know it as well, which is that in the next 7 years, that is between now and 2030, we're going to have more than half of all girls in the world, nearly 1 billion, who will experience at least one extreme weather event. And we also know that when we say at least one, that's a huge underestimation. That is, in fact, many, many weather events, because that is the way they are kind of piling on. This is the global reality. And when we look at it on the next slide with respect to the regional reality, we see that a kind of a hotspot list has been created. This has been presented in a recent report by Save the Children, which is a great report, and it includes a lot of interesting information, a great overview of the issue. If we turn to the next slide, Emily, you can see what I've presented here, which are the top 10 hotspots in terms of vulnerability for girls globally when it comes to climate crisis and child marriage and all of the overlapping threats. And you'll see that Bangladesh is number 1, and then numbers 2 to 10 are all in sub-Saharan Africa. And looking at the participant list today, many people who are living and working in these countries are present today, so on our call. So it will be just great to hear from all of you in terms of your perspective on these issues. I mean, we know that the countries that are listed here as hotspots are also many of which experience civil unrest, political conflict, very high poverty levels, and gender inequality already. And that many of them have some of the highest population growth rates in the world. That is to say, the numbers of girls and families and boys who are going to be affected by these issues in the years to come is going to increase. So we have a kind of as a Canadian, I'm going to use the snowball analogy, which is just that as it rolls down the hill, it gets bigger and bigger. And we are seeing the impacts more and more on more and more people. Next slide. I know I'm kind of blasting through here. What I've listed here are just sort of 3 categories of response strategies that are in place by various agencies, including many of you as UNICEF and larger NGOs and governments as well. We are talking about kind of a range of responses in kind of 3 main categories. The first is in child responsive climate finance. That is trying to look at climate financing as trying to have climate finance be explored through the lens of its direct impact on the most vulnerable girls. And the way that this has to happen is, of course, involving many, many more girls and their families and their male siblings, peers, and relatives as well, just in terms of trying to understand better what it is they need. And when Ken gives his presentation about Kenya, the research that's being done there, you'll see very clearly what some of those things are that are emerging. The second kind of major category, which all of you I know are in the midst of doing, is kind of increasing investment in the services that are most important for girls, both in terms of prevention and response. And these are services that are kind of nimble and flexible and that can be provided in a range of circumstances. And I think Haider will speak to that as well when he speaks about the Ethiopian situation. And then, of course, this provision of social protection, not just in the midst of the climate shock, but also in the ensuing months in order to enable people to manage the shock. We're going to talk about this much more and hopefully going to hear from all of you in terms of the kinds of things that you have happening in your countries, either in work that you're involved with or that you're aware of. Finally, my last slide is just about areas for discussion, and we can just kind of keep these in our minds maybe when we hear our presentations that follow me. I mean, the first one is kind of having this webinar as an opportunity to hear from you what is being done in your country program and what you're doing in your child marriage work to respond to the threats that are posed by climate change, and what your successes have been, and also what the challenges have been that you've faced. I think we don't talk often enough about the huge challenges that we've faced and the things that we have tried that haven't worked as well as we'd like. And this, I hope, will be an opportunity for people to share those experiences. And really importantly, will be get a sense from you, what are the sort of information and support needs that you have in order to do this work. I think if any of you are like me, this is such an overwhelming issue, and at times it's hard not to feel a bit despondent and despairing about it. But I heard someone say the other day that there really isn't time for despair, and I think that it really comes down to that for this very important work. So thank you for joining us, and thank you for the participation that we are asking you to do and have in the coming hour or so. That's it for me. And so now what I'm going to do is introduce Ken Ondoro, who is a colleague of mine at Child Frontiers who's been engaged in some research in Kenya in 3 different sites, exploring the impact of climate change on the everyday lives of girls and boys and their families. Over to you, Ken.
Thank you, Gillian. Let me just share my screen. Can you all see my screen?
Yes, we can. If you can put it on slide mode, please, Ken. Thank you.
All right. Thank you, Gillian.
Merci Gillian pour votre présentation. Je vais me présenter. J'ai 15 minutes pour cette présentation. Je vais essayer de faire
Is
tout
it just
ça.
me? I'm hearing the French interpretation. I don't know if, Ken, you have selected the English option under the interpretation so that we can just hear you in English.
I was also
Thank you.
hearing the French interpretation.
Okay.
Okay, do you want to try again, Ken? And let's see if it works. Just make sure you're in the English channel. And if you just hover over the interpretation option at the bottom of the screen and then click English.
I'm trying to do that.
Yeah, sorry, you might
Maybe try and stop sharing. Stop sharing and then click on the interpretation. It should be easier to see.
Okay.
And dear participants, bear with us as we try to sort this out. It's such an important presentation for us, and it's good that we all can communicate in at least and hear each other in one language. Thank you for your patience.
Thank you. Am I now in English?
Yeah, you made it. Thank you, Ken. Over to you to share your screen.
So, all right, sorry for that. So let me start by briefly introducing myself. My name is Ken Ondoro, based in Kenya.
Sorry, Ken.
Part of
We're unable to see your PowerPoint presentation. It says double click to enter full screen mode, but we can't see the slides.
It may just be taking a little bit of time to come up. If it doesn't come up, I can share my screen instead, Ken. Just give it a second or two. Yeah, there we go. And if you just put it in slideshow, Ken, that'd be brilliant. That's it, perfect.
Thank you. Apologies for all that.
No problem.
Yeah. So I'll quickly rush through this study. It's a study on the impact of climate change we're looking at child marriage, teen pregnancy, and FGM in Kenya. Specifically focused on 3 counties here in Kenya: Turkana, Kajiado, and Kisumu. I will not go into the background, but I can speak a little bit about methodology, then move straight into the findings. So in terms of methodology, this study is predominantly qualitative study. So we've employed FGDs, key informant interviews, and case studies with a few girls selected in those 3 counties that the research is being conducted in. For more details, I think we'll be able to share some piece of writings on this study, so you can get more details on methodology later on. Let me move to the findings. And in terms of climate change, these 3 regions, but let me first speak about Kajiado County and Turkana County, because they share more or less same climatic conditions. In Kajiado Central, which is a sub-county where we are conducting this study, they had not received rain for the last 3-4 years. And in phase 2, when we went back in July, I'm sorry, in August, not July, we found that they had only received rain once in July. And the same also in Turkana County and in Turkana Central and Loima sub-counties where we are conducting this study. They had also not received rain for the last 3 years, but when we visited in September, we also learned that they had only received rain once in June. So, failure to receive rains, of course, has had a negative impact on agriculture in terms of food insecurity. There are reports, from our discussion with the community members, that most of the families lost their herds of cattle, and most of them lost almost everything. That applies to Kajiado Central and Turkana Central. In terms of Nyando County, I think there was an unpredictable periods of drought and flooding. So when we were there in May, there were floods. When we went back around August, there was drought. Just before the flood, it started raining when we were there in May. Before that, they had also not received rainfall, I think, for about 2 years or so. And right now, as we speak, they're preparing for their, it's predicted here in Kenya that we'll experience El Nino, so they're also preparing for that. I heard that it rained yesterday, so it keeps fluctuating between periods of drought and flooding. So in terms of cross-cutting issues, the issues that we are focused on, we've learned that there's increased levels of household poverty. I think just like Gillian has mentioned, school dropout rates are quite high, where children are just away from school for school levies, let me call it so, because in Kenya they say, the government is subsidizing education. So in primary school and high school, there are no school fees, but there are certain school levies, but the community members call them school fees. And lack of basic needs, especially for girls in terms of food and sanitary pads. And actually you will see in the whole of this presentation that food and lack of food and sanitary pads has actually put girls in a very vulnerable position or situation where there's a lot of transactional sex, but mainly linked to food and sanitary towels. Issues of increased mental health among adults and children. We were just having a discussion the other day with Emma, who is my colleague in this a piece of work, that there is no focus group discussion we've had in the community where there are no one or two community members who are extremely drunk. And they talk about high levels of stress, mainly emanating from the fact that if you look at men used to have cattle, they used to be the breadwinners, providers in their families, and now they can't do that. Secondly, the only livelihood activity they know and they have been engaged in for their entire lives is livestock, and now they don't have that. They're trying to look for alternative sources of livelihood, and as all of you and I know, that takes a very long period of time. They haven't figured anything out. There are reports of suicide amongst adults and the youth as well. In the three counties, Turkana, Kisumu, and Kajiado, even just recently, as I was coming from Turkana County, there was a report of an adult man committing suicide. Of course, poor physical health among children because of lack of food, issues of malnutrition. We are also learning about negative coping strategies among younger generation and adults as well. So there are high incidences of theft by boys and young men reported in the three counties. Alcohol consumption also high in the three counties. Transactional sex, in our own observation, has gone over the roof. When we were there for phase 2, we learned that actually the issue of transactional sex is moving from bad to worse in these three counties, and mainly girls seeking to obtain either money or food. So money to buy either food and or sanitary towels, or they also can obtain food and or either sanitary towels. And there's a lot of exploitation going on, of girls in this context. They also reported cases of prostitution among adults, especially married women, but it's also more transactional. It's for food or for money. And then we are also seeing negative impact on the environment in terms of sand harvesting, especially in Kajiado County, and charcoal burning in Turkana County. The last time we were there, which is last month, in the community where we are conducting the study, they reported to us that they had almost cleared all the trees. And so the charcoal business was going down, and they were complaining. They were requesting for help or to get other sources of livelihood, because what they depended on, which is charcoal burning, is going down because they have cleared almost all the trees. So there are no more trees for charcoal burning. Down in family and community social support mechanism, they're talking about communities, people in the community being equalized by the drought. And what they mean by this is that everyone has almost lost all their livestock, which is a source of livelihood. And the way these communities are structured, especially in Kajiado and Turkana, is that initially, whenever there were droughts, there were members of the communities who had larger herds of livestock. And so what would happen is that those who had a few herds of livestock, if you lose your livestock, then those who have higher number of livestock would then share some livestock with those who have lost their livestock. But during this long period of drought, almost everyone in the community have lost their herds of livestock. So we had figures like someone had 3,000 herds of cattle, lost everything. Someone had 500, 100, lost everything. So they're saying everyone has been equalized in that community. And then in terms of families, data is also showing us that the drought has had a negative impact on the family units. Families are physically breaking down. A lot of migration happening. So in one of the counties here in Kenya called Kajiado, people are migrating to the nearby towns. There's a town called Kitengela. People are migrating there. So girls are dropping out of school, migrating to that town to go seek for opportunities to work as house help. Boys are equally, and young men are equally dropping out of school and moving to these areas to look for work as night guards. And even some parents are also moving to these places to look for alternative sources of livelihood, to look for work. In Turkana County, also the same. We are seeing huge migration from the neighboring villages, moving to a town called Lodwar, which is the biggest town in Turkana County. And either children moving there, there has been an upsurge of children living in the streets, young men and women also moving to Lodwar town, migrating to Lodwar town in search for work, and also some moving to just live with the relatives who are living in town. And marriages are also breaking down due to this stress and this displacement. In terms of teenage pregnancy, as I had mentioned earlier, is that we are seeing an increase in teenage pregnancy. And remember, these are qualitative studies. So when we engage the community in discussions, they report to us that teenage pregnancies are increasing. And also, this is a study that we have done for almost 1 year now, and we also do observations. And we also have informal discussions with the community. So in an area like Kisumu County, one of the girls who was part of the case study had gotten pregnant just within phase 1 and phase 2, which covered from January to August. I think in Kajiado County, one of the girls who was part of our case study also got married during this period. And we are observing these things in the community. The other thing is that these girls are getting pregnant way younger than before. And there are girls who are reported getting pregnant at 10 years, 11 years. In one of the counties, there are 2 14-year-old girls who are reported to have, given birth. One of them, gave birth to twins, and just because of that, she was going through a lot, which I think time will not allow me to mention now. But the issue is that these girls are no longer under the watchful eye of their parents as it used to happen before. And it is because the parents are equally stressed. The parents are equally, either moving long distances or moving away, leaving these girls alone in search of work to support children. The other aspect of it that we'll also talk about later on in this presentation is the limited understanding about sexuality, pregnancy, family, sexual and reproductive health, access to sexual reproductive health, having that knowledge about sexual reproductive health is extremely limited in these two, the two contexts, mainly in Turkana and Kajiado, but a little bit different in one of the counties in Kisumu County, one of the counties where we are conducting the study here. I'll speak to that later on. Now, coming to marriage, we are learning that marriage trends generally, not even child marriage, is changing in this context. And so there are two types of marriages that are now taking place. One, the traditional arranged marriages, where parents of the girls and the man, are involved in the whole process, and there's also an exchange of livestock. However, we also learned that during the long periods of drought, almost everyone had lost their livestock, apart from maybe in Turkana. There were reports that those who live close to the borders of, I think, Ethiopia and Uganda had some pasture, and so they had a bit of livestock left. But in the areas where we are conducting the study, we are learning that most of these girls are married off on loan, and this is their own terms. They're saying that girls are now married on loan because no one has livestock to give. And so you're giving a girl on loan and they wait until it rains. And if it happens, the livestock after the rain, then you can now bring the livestock. In Turkana, we also learned that according to the culture, you're not supposed to give thin and healthy livestock. So you have to wait until it rains for you to bring the livestock. So that's traditional arranged marriage. However, the informal peer unions, what they call in this context where we are doing the study, Come We Stay, is seemingly higher than the traditional arranged marriage. And so, also this Come We Stay has a very negative impact on the health and well-being of the girls. So they're reporting that girls either just disappear or girls make their own decision to run away, in quotes, from the problems at home because there's lack of food. Some of them are not going to schools, and so they remain idle. But most of them reported just running away from the problems at home, and they decide to go and get married. So some get married to their boyfriends, some move to towns, hook up with the men and boys in town, and they end up getting married. So in these marriages, you find that the parents are not involved, and there are no exchange of cattle. And I think I've talked about the slide there just speaks about among the Maasais and Turkana that bride price was shared within the community. So it was not just the parents of the girl to receive everything, but the bride price in terms of livestock would be shared by the uncles, and everyone would have a piece. In the Luo culture, it's a bit different in the sense that, one, the number of livestock compared to, for example, Turkana is quite lower, and number two is that the payment of bride price can be delayed it doesn't have to be paid almost immediately, like in these two other contexts. In terms of FGM, I'll quickly rush through this. It appears that it is not directly impacted by climate change, especially it is only practiced in one of the counties called Kajiado County here. The other two counties in Turkana and in Kisumu, there's no practice of FGM. But we're also learning that the practice is changing a lot as a result of sensitization, although it is not clear whether it's increasing or decreasing. And so in the area where we are conducting the study, AMREF implemented a project on FGM where they did a lot of sensitization, alternative rites of passage, and they also have a database of the girls who were involved in that study, and monitoring them for the next 20 years. And so with that, and the community, when we just came in as the project was coming to an end, so it was difficult to tell whether the practice has genuinely decreased, remained at the level where it was before the intervention, or it has decreased, because the community members kept telling us, it is no longer there, it is no longer being practiced. But interviews with young boys and girls revealed the opposite. But we kind of understood that maybe it's as a result of the sensitization that was done by AMREF. Now, what does this mean for the child protection sector? Now, there's a slide I've not talked about, but in phase 2, we are learning that there's a changing perception of the community members, of the community towards child marriage. So most of them are saying that the only way to fight drought right now is educating girls. And they're not only talking about, academic kind of education through primary, secondary, and university, but they're also talking about TVETs, technical and vocational education and training. And they are saying that because of what they have went through as a result of the drought, they have only observed that the families where girls are educated are the families that are thriving right now. Those are the only families where, and so they are talking about girls and boys. Those are the families where they are seeing the parents of these girls having 3 meals in a day, they are healthy, they have water, and they have access to medical services. Other families where girls and boys are not educated have been, suffering as a result of this drought. They have no any other source of livelihood. There is no external support. And so that is changing their perception towards education. And we have not analyzed phase 2 data, but I hope we'll have an opportunity to report this later on. So there's that shift that is happening. The other thing is about the significance of access to SRH services. And we are seeing mainly in these two contexts, because there has been an intervention on SRH in Kisumu, in Nyando sub-county, in Kisumu County, but in Turkana County and Kajiado County, specifically in the area where we are conducting the study, is that there's either limited knowledge or completely lack of SRH services. There's no health facility that is close by. The health facility that is there is not yet open, but was meant to be opened by the county government. So this is a gap that we have observed in these two counties. Huge gap in terms of access to SRH services and sex education as well. And then I talked about the issue of sanitary pads, that it's becoming in these three contexts, actually, these three counties, that is becoming a very, very big issue. And it's actually exacerbating the vulnerability of these girls, because if you look at our data, most of the people we speak to talk about girls being exploited, not only because of food, but because of sanitary pads. And this has had also a negative impact on the issue of teenage pregnancy. And in terms of intervention, we are observing very short-term interventions in this context, either in terms of relief food or in terms of cash transfers. So in these areas, we're seeing some cash transfers going on for 3 months, others for 7 months. And you see the drought is now taking more than 4 years. And so the community members are saying, can we have sustainable solution? Can we be empowered with either business skills? Can we be empowered to do agriculture? Can we get water so that we can do farming? Can we get support in terms of educating our girls? So they are saying cash transfers are not bad, but they are short-term. And you hear them talk about things were good for 3 months, and I was able to buy food, I was able to buy sanitary towels for my girls, but now there's none. So I think that's the end of my presentation.
And thank you very much for a very interesting and hugely thought-provoking presentation. I have so many questions. I'm not going to steal the limelight here. Before we open up the floor to questions and other kinds of contributions, I would like to ask Haider Ahmed, who is the Child Protection Manager at UNICEF Ethiopia, to just share with us for a couple of moments his reflections on the presentations and the experience that he has and his colleagues have in Ethiopia when it comes to climate change and child marriage. Thank you.
And thank you, Gillian, and thank you for the good presenter who has brought a lot of issues, including transactional sex as a result of this. So we really appreciate, and that's one of the coping mechanisms that goes beyond even child marriage and goes to exploitation and abuse related on children and women sometimes. And in relation to Ethiopian context, we have seen when drought or conflict comes, girls are being given to a family. They feel that the girl will be raped or defiled, so they fear the impact in terms of teenage pregnancy, the shame that it will come, the loss of bride price and dowry related on this. So on the conflict side, girls are being given with little bride price. But on the aspect in terms of the drought that we have witnessed in the context of Ethiopia, and recently, is we are also seeing that the communities are also exchanging fuel. For example, in the border to Kenya, where some of the research was done in the bordering to Turkana, a place called Dasenich. We are seeing girls are being exchanged of fish compared to a cow. In that community, they keep cows mostly. So we are also seeing that also in the Somali regions, girls, the bride price being decreased as a result of few available resources within the communities. I think one thing that will be much important in the context of Ethiopia is for all issues around even floods contribute to child marriages. For example, in Gambela region, which is also bordering to Southern Sudan, we are seeing girls. This is a flood-prone area, and people come and live to a high land during the floods. And they see that girls are more vulnerable when the community lives together, because they can't manage in terms of the timing of the girl and in terms of the night, taking care of the girl. They see very few people to access, because the community where they live, everybody lives with his own compound. So access to compound during the normal time when there is no floods is very difficult, because the father questions, the mother questions. But during flood, people will be crammed in a small locality where they can access quickly boys and girls. So we are seeing that also in that aspect. Floods breeds teenage pregnancy, and also again the girl will also be married as a result of that. Though in that context, in that community, the bride price will not be lessened, even if the girl is because there is they have a cultural system where the husband will pay a fine, or the boy family will pay a fine for impregnating prematurely the girl, and they will pay the bride price for that. Though there are some circumstances where the family refused because of the limited resources, because these are community who normally pay bride price from 5 cows to 30 cows maximum, or sometimes it goes beyond, depending on the beauty of the girl, the tallness of the girl, and all those aspects. So we also see conflict arising from such situation, because the family do not want their cows to be taken away, or their homes to be taken away, to take responsibility around on this issue. So this is an aspect which is very important in the context of Ethiopia. The other issue which was very important is that in Ethiopia, we have seen, for example, again, looking back again, the southern part of Ethiopia, we have seen the increase of FGM, which is around that region 27%. But we also see a 200% increase in terms of compared the increase of of FGM. For example, the increase of child marriage was 56.5%, while the percentage increase for FGM percent. For us, when we look back, this is very interesting. We know that those communities, they marry girl after undergoing FGM. We are seeing that maybe there are girls who were previously before the onset of the drought, who were cut and who were ready to be married at that time, or the increase of the number. So sometimes we can sense there is also a demand for child marriage will also create a demand for FGM in that context, in the Ethiopian context. So I think this is something which is very important, and I'm sure I also recommend and commend the Kenyan team who have done the study. I think it will be very important for us. For example, in Ethiopia, we have not done particular research, but we were being informed through what we normally call the trend analysis. The trend analysis is you compare when before the onset of a flood and before the drought or before the conflict, and you compare during the conflict, the two data. You set aside the two data. And one practice that we have gained is that we only entertain those data that has been brought by the government officials, because credibility of data is very important. Civil society collect those data. But if the data is not owned by the regional government or the regional Bureau of Women and Children or the regional children office, then it also creates some credibility. How do we also collect the data? It's also very important because you need to make sure that that data is a government data driven, because it creates a lot of concerns within the civil society. So all the analysis that we have done, we were making sure that the region, the data is being collected and confirmed by the regional heads of that region that we are doing. I think as I wrap up, I don't want to take more time. And one thing that we need to learn from the presentation is that it will be very important for us to be shared in terms of the methodology, in terms of conducting this study, if it was done, and during the onset of the drought, and how was it methodologically navigated, because it also created some issues, ethical issues. Will be very important for us to understand and also to learn as we go through. In the Ethiopian context, we want to look back. There are lessons that we have done. For example, particularly, we are doing a national training to also to see how can we bridge, because the cycle of development and humanitarian is always a cycle. Shall I say it continues like a cycle? So you go out from the development, you go to emergency, you come back to recovery, rehabilitation, you come back to the development setting. Then emergency comes. So this is very important aspect. I think will be very important if that data can also be shared with us as we look forward in terms of interventions. My last thing is that when an emergency sets in, you cannot run like you are working in a development setting. Emergency is very quick. It outpaces you in terms of programming. It is good to focus what is the low-hanging interventions that we need to continue. In the context of Ethiopia, we focused only community conversations, parenting engagement. We also focused adolescent programs and issues around surveillance, because surveillance, the reason why we have used surveillance was these are time when the child marriage was very high. We wanted to make the social intelligence gathering and connect to the government focal point in terms of deterring occurrence of child marriage, in preventing it, and also when it happens, how can we address within the systems, both the system, the early warning systems, including education, including health, which is responsive, also the legal and also issues around cancellation, which is an informal system that we normally employ in Ethiopia. So this is very important because emergencies happen within 3 to 6 months. So the interventions within those 3 to 6 months. So it should not be a development intervention focus. It should be very short and succeed, and should not be lengthy as of development programming. Thank you.
Hi there. Thank you so much for that presentation and for your reflections and your sharing your experience in Ethiopia. I really appreciate the kinds of alterations in thinking, the redirections in programmatic focus, all the kinds of things that have to really be done on the fly when it comes to work in this area. One of the things I'm wondering about is we have a few questions in the chat. Some are very specific, a couple are more general. If I start with the specific, then I think I might open up the floor to asking participants to share with us their reflections and the extent to which the presentations resonate with their own experience or any research that they're involved with in the country contexts where they're working. The first question is asking whether or not we, I assume this is for Ken actually, if you saw an increased risk of child marriage, teen pregnancy, and FGM for girls or children with disabilities in the 3 counties where the research was done.
Thank you, Gillian. Thank you for that question. So I think we looked at children in general. We did not go a bit, we did not go deep into children with disabilities, but of course, in the context where we work in, we observed, like during the floods in Kisumu, Nyando sub-county, we saw children with disabilities could not move as fast as, children without disabilities. But also in phase 2, that is when we interacted with some data in terms of the community talking about children with disability and talking about it's very difficult to take care of these children in this context. In terms of sexual exploitation and abuse, we have not come across any data with regards to exploitation of children with disabilities in this context. But I understand that there could be, issues. I know children with disabilities could be more vulnerable than these other children, but that was not the focus of our study. So we might have missed a thing or two with regards to children with disability. Thank you.
Thank you, Ken. I'm sorry, my dog is growling right beside me, everyone, so I apologize. There are some specific requests in relation to accessing studies online, etc., and we can definitely provide that. There are a couple of other questions. One is, well, the first is a comment that says the findings of the research presented by Ken are similar to the multi-sector long-range assessment findings that were led by the National Drought Management Child Protection sector in Kenya. I think that's really interesting. And if the person who posted that is interested in discussing that a little more, that would be great. There is also a particular question again for Ken. Did the study in Turkana establish any link between social protection and effective drought on child marriage? Turkana County has multiple social protection packages.
Let me see the question. Yes, so again, it is true that in Turkana, there's a lot of social protection intervention. So in the context where we are working in, there's a lot of cash transfers happening. So there was Red Cross, there's I think the national government and the county government. And actually the community said that these cash transfers have been of great help to them. And as I had mentioned earlier, that they use these cash transfers to provide basic needs to the girls, including sanitary towels, food, but also support girls in terms of going to school. And what we are seeing is that education, a focus on education is key in terms of addressing child marriages. There's a very strong link between access to education and the child being in school and children not getting married early. So yes, there's that linkage. Thank you.
Thank you. There is also a question from Justine in Congo, DRC, who has said, thank you for the interesting presentation. I'm wondering if you had any evaluation on strategies put in place that were successful in responding to child marriage risks from the suggested actions for the child protection sector. Any example on how you worked with other sectors to address this? For example, looking at the need for sanitary pads, food, and education, and how did you work with communities? I think that question may be partly directed towards Ken and partly towards Hyder. And I welcome others who've been involved in programs in this area as well to jump in with some comments and reflections. Thank you.
Thank you,
And
Gina. I think
I had,
sorry.
can you hear me? Hi, I just wanted to respond. Can you hear me?
Yes.
Thanks. I wanted to respond to the, basically on the question on the, I had actually put the comment. I'm Bindu Abraham, the Child Protection Sector Coordinator working with UNICEF Kenya, especially on the findings of the long range assessment, which is the basically where we look at food insecurity classification, which is a decision-making tool, a multi-sectoral tool, which government uses post a drought or in anticipation of a drought for multi-sectoral programming. And for the first time, I think in about, since this drought the food insecurity classification and the multi-sector long-range assessment had begun, we were able to put in some indicators for child protection. And I had put in a comment that the findings are very, very similar to the long-range assessment, which came out in August on the issues of child marriage, especially transactional sex and increased violence against children. And again, the issue of sanitary pads, it's really interesting that this came out because the findings which we did was for 23 counties, which we call the ASAL counties, which are basically drought-prone areas. And all the 23 counties had very similar findings in terms of transactional sex and the whole issue of child marriage. So, and also, of course, as which Ken has rightly brought out, all the different issues which interlink and increase child teenage pregnancies. So I find this interesting. And also the fact is that this particular long-range assessment and as a government policy document, why it becomes important is because as Haidar mentioned, it has government ownership. So this is very much an issue which is being discussed by the child protection sector in Kenya. And I think definitely in terms of a multi-sectoral approach to addressing it. Having said that, it's not that simple because, for example, the issue of sanitary pads and transactional sex, this is something even for myself, I brought it up several times with the various sectors which actually lead on some of these issues. And having said that, the issue still continues. And I think we have to work collectively in looking for longer term solutions where it seems like it's a short term thing as to why is it that, sanitary pads and girls are having transactional sex and we cannot fix the problem. Having said that, it's still prevalent and we're looking at more multi-sectorally how we really look at even from a resilience programming and how this is going to be tackled, considering the fact that there's technically the drought is over and then the funding is actually reducing. Yes, yeah, these are very much issues at this point of time Kenya is contending with. Over to you, Ken.
Thank you, Bindu. What I wanted to say has skipped but I just wanted to more or less talk about what Bindu has talked about, that from the data that we have, we are seeing that interventions that focus on education, health, and livelihood, I've had more issues of child marriage in these contexts where we are conducting the study. Thank you.
Thank you, Bindu and Ken, for that. There are some comments here as well. One commenting on the importance of girls' education as a mechanism to prevent child marriage. I would also like to welcome anybody here who's on the call who has reflections or comments that they'd like to share with the group, perhaps with respect to interventions that you've tried, what's worked, what hasn't worked, or even questions. How do I manage to work in this ever-changing situation? Anything. We are here as a community of practice. We're here to support each other to do our work as best we can. So please feel at ease and comfortable to share your questions and comments. Does anyone have any particular reflections on the issues that Ken has raised when it comes to increases in transactional sex or in the provision of SRH information and services in the context of crises? If you have information or experience in that regard, would be very welcome as well. Well, in the absence of that commentary, what I'd like to do is to pass the mic or the screen to Catherine from Wakaro to wrap us up. But before she does, I would just like to say thank you to all of you very much for your participation and for your great insights, particularly to Hyder and to Ken. And really look forward to learning more from all of you in the weeks and months to come. Thank you. And also to the translators, of course. Merci beaucoup.
Thank you very much, Gillian. I hope everyone can hear me. And let me also thank you for bringing us together, to Ken and Haitha, for their presentations and their reflections. It was really, really very insightful, very, very useful to learn. And I really, really appreciated Ken's presentation of the qualitative insights into what climate change actually means to the everyday life of girls and their families. It was really, really insightful. Thank you. So to wrap us up, let me please ask all of you to complete a short poll that Emily will launch, just so we know who was on the call and to make sure we invite the right people next time around. And sorry, I have something on my screen. Okay, and then I would also like to let you know that the next webinar is planned for November or very, very early December. And this webinar will draw together all the findings and lessons learned from the process of developing child marriage strategy notes. So I think that will be very important and interesting for all of you who are regularly daily working on this issue when you're thinking about how to respond to dynamics, changing situations, opportunities or bottlenecks that might emerge in your countries. So I think that will be a very important webinar as well. And as said, it is planned for November, perhaps early December. You can please join the mailing list that has just been put to the to join us. It was a really interesting webinar, and we hope to see you soon again in November or early December, and we will keep you posted.